Hello, everyone. Thank you for coming to tonight's webinar on why a GPR/AEGD program presented by Pennsylvania Dental Association. Our presenters here tonight, we have Dr. Elizabeth Palowitz. She's from the University of Pittsburgh and UPMC GPR program. We have Dr. Larry Morrow. He is from University of Pittsburgh GPR Rural Expansion. And we have Dr. Mark Henschel from the University of Pennsylvania AEGD program. They're going to start by going over these 4 bullet points here. One is the purpose and goals of each program, benefits and real-world experience, enhanced earning potential, networking and mentorship, and personal growth and confidence building. So Dr. Palowitz, you can go ahead and start.
So thank you very much for taking time to meet with us today. I think your curiosity about postgraduate education is fantastic. And the sooner that you start thinking about this, the more beneficial it will be for you. All 3 of us are very, very dedicated to offering new graduates the next step in their education. The purpose of all of our programs universally is to help new dentists enhance and expand their basic pre-doctoral learning in general dentistry. So the G is the same. It's general for whether it's a GPR or an AEGD. So we are general dentists and we are educating general dentists. So fundamentally, the purpose and core goal is to give our residents an opportunity to greatly expand their experience and knowledge base for complex multidisciplinary patient care. A GPR also has the added component of having a hospital component. So for us specifically at Pitt, it breaks down to about 2/3 of a clinical dental practice focus and 1/3 of a hospital or hospital-based focus. And within that is oral surgery training and exposure. It is internal medicine, hospital anesthesia, emergency department medicine, and the treatment of the medically complex patient. We also spend time in our program giving our residents an opportunity to train in anesthesia, giving them the opportunity for an expanded Pennsylvania dental license for light and moderate sedation. In addition, we have a Center for Patients with Special Needs where our residents will do cases under general with their patients under general anesthesia. And we also have a dental phobia clinic where our residents will learn how to manage patients with dental phobia with oral sedation. So our core goals are to take our residents from well-trained and confident new graduates to well-trained and confident new dentists. We consider ourselves a stepping stone, or really more importantly, a building block to allow you to treat all of the different types of patients that you would see in your general practice. What the benefit and what the real world experience is that you're going from a highly guided and checked dental school experience to what we call progressive levels of responsibility in our practice, in our program. The amount of attending oversight and interaction in September is greatly different than the amount of attending direct over-the-shoulder supervision in April. It allows you to get quicker and more confident while still having a fantastic support and safety net. It also gives you an opportunity to expand your knowledge base on the procedures that are involved in a multidisciplinary case. Our goal is to help you put together what we call a portfolio of at least 4 to 5 big multidisciplinary comprehensive cases throughout the course of the year, while also becoming proficient, solid, and efficient in quadrant direct restorative dental procedures. We do give you the real world experience of working with a front office staff and a chairside assistant and understanding treatment planning and the business of dentistry. We have a digital workflow, which also gives you real world experience. And it allows you to work in a team setting that looks a little bit more like a group practice. So I'm going to stop talking there and let my colleague, Dr. Morrow, take over on the next goals that we have.
Thanks, Dr. Polowitz. Uh, so I think these, at least three and four, and possibly even two, regardless of whether or not you do a general practice residency or an AEGD, they're going to have similar benefits and between the two programs here. Really, the purpose and the goals of each of the programs is slightly different. Uh, but but either one of these programs is going to have a direct effect on your enhanced earning potential and networking capabilities, mentorship opportunities, growth and confidence. I think three and four kind of go together because the personal growth and the confidence that you build during this year is going to have a direct effect on your earning potential. The relationships that you form is going to maybe get you a leg into a position or an opportunity that you might not have had before. Now, a lot of depending on what type of practice you want to go into, if you want to go into private practice, I'm on the private practice side. I'm relatively newer in the academic world. I've had hired many multiple associates during my time. I never really said, well, you have a GPR or you did an AEGD, so I'm going to pay you more percentage of what you're going to do. It just never really worked out that way, but the confidence and their skill set was so much better than those who just came out without doing an extra year of training that they immediately made more money because they were able to do more procedures. They had a confidence to do more procedures. They had the ability to do more procedures and more complex procedures. Uh, and maybe by having that GPR, that AEGD on your resume when you applied for a position, that very likely gave you a leg up for somebody who didn't if you're applying for that same job. So overall, like I said, an AEGD, a GPR program, these two, three, and four are going to be very similar between the two programs here. The purpose and the goals is what really sets it apart. And so I'm going to let Dr. Henschel talk about his purpose and goals of an AEGD program in comparison to what Dr. Polowitz discussed just earlier.
Okay, good afternoon, and thank you all for attending. I know it's late in the hour, past dinner time probably, but that's okay. So, AEGD versus GPR program. An AEGD will focus on enhancing your general dentistry skills through a comprehensive training. Our program aims to provide advanced education in various dental disciplines. Okay, we aim to develop advanced clinical skills in general dentistry, gain experience in various specialties like perio, endo, prosto, and oral surgery. It also fosters a deeper understanding of treatment planning and especially patient management. Some of the benefits of our AEGD program is you'll get increased confidence with clinical skill and decision making, an opportunity to work with a diverse patient population in an outpatient setting, potential to improve practice efficiency and patient outcomes. Patient experiences. Our residents typically work in a clinical setting, providing care while gaining exposure to various dental procedures. They often have a structured curriculum that includes didactic sessions and hands-on training, allowing them to refine their skills in a supportive environment. We briefly discussed earning potentials, and I have to agree with Dr. Moore. I don't think, in my experience as a private practitioner, I have to admit, if someone applied as an associate without advanced training, either GPR or AEGD, quite honestly, I didn't necessarily give them the benefit of an interview. I feel it's a wonderful year of growth, and it really separates the people just graduating from dental school versus those that are now getting a certificate in a GPR and AEGD. And that does make a world of a difference when you are a private practitioner wanting to add an associate that will be able to do competent dentistry and take care of your patients in the manner that you want them to be taken care of. So earning potentials, advanced skills, AEGD programs provide specialized training that can advance clinical skills, making graduates of our program more competitive in the job market. More competition, more competitiveness means you can conceivably get higher salaries, expanded services. Graduates often offer a broader range of services, attracting more patients and being able to increase revenue. And I'll touch upon that in a moment. And job opportunities. Many employers prefer or require additional training, so having an AEGD can open doors to higher paying positions or prestigious practices. Within the AEGD program, which is basically university-based, you develop professional connections. It often includes a diverse cohort of dental professionals within the university itself, allowing for valuable networking opportunities that can lead to referrals and collaborations, especially collaborations if one is hoping to become a specialist someday. And unfortunately, maybe you didn't match the first year around into specialty training, and now you're going to spend a year in an educational institution to get a certificate and try to rematch a year later. This allows you to really meet the specialists within the University of Pennsylvania. Networking, as far as alumni networks, graduates join the alumni community right away. In fact, during our orientation week, you get a half-hour conversation with our alumni relations person, et cetera, et cetera. I always tell that alumni person not to ask for money right away. That's not the point of her conversation with us. Industry exposure. Our programs provide access to conferences, workshops, and seminars where professionals can meet industry leaders and peers. Access to experienced dentists. AEGD programs typically offer mentorship from faculty or experienced practitioners. The majority of my faculty are all part-time faculty members who do have their own private practices locally within the Philadelphia area. Most of these providers also have friends that are looking for associates in other areas of Pennsylvania. And it's peer support. Working alongside fellow residents fosters a collaborative environment where participants can share experiences and advice, enhancing their learning through peer mentorship. And again, personal growth and confidence building, I can't stress that enough. You get skill mastery, you gain proficiency in complex procedures, you boost your self-assurance, and it reduces anxiety that you might have in certain clinical situations. For instance, day one, you come into program and you're doing what you appear to think is a simple extraction procedure. You fracture a root. What happens? Usually there's a panic that sets us inside, or you're very anxious. But by year end, you learn how to work yourself out of that issue without panicking, without the anxiety setting in. Problem solving, overcoming challenges during training fosters resilience and critical thinking, which are essential for personal and professional growth. And there's also potential for leadership development. Many of our programs emphasize leadership training, helping participants, helping residents build confidence in managing teams and patient relationships. So in closing, both advanced education, general dentistry, and general practice residency programs offer postdoctoral training for dentists, but they have different emphases and structures. In summary, while both programs enhance dental training, AEGD might focus on advanced general dentistry, where GPR emphasizes, and I know Dr. Morrow, Dr. Pavlovich are going to probably disagree with this comment, but whereas GPR emphasizes care for medically complex patients, choosing between them depends on your career goals and interests in either general practice or a more medically integrated approach. And overall, an AEGD program can be a transformative experience, enhancing both professional capabilities and personal development, leading to a more fulfilling career in dentistry. And I know one other thing I'd like to mention, even though our program is university-based, 40% of the patient population that we treat are those patients who have specialized healthcare needs or disabilities. We have a collaboration with Woods Mikey Faulkner Dental Facility in Langhorne, Pennsylvania, where 40% of my residents' time is spent treating those patients who are disabled, who have intellectual disabilities, autism, Parkinson's disease, Alzheimer's disease, any disability you can name it. We also get involved with, yes, the medically complex patients. One of our best referral bases within the university itself at Penn Dental Medicine is we get referrals from our pre-doc students within the building who basically their group leaders have determined that the patients are too medically complex to be treated in a clinical setting or a pre-doc setting. So we get a number of those patients that we treat on a daily basis. I can list the number of LVAD patients we treat, left ventricular assisting device patients we treat, you know, off the top of my head, very routinely. We also have a collaboration with the Hospital University of Pennsylvania, where we started, I would have to say, a year and a half ago, doing the consultations. I mean, the HUP likes to call it dental clearances. I'll call it consultative report, where we basically are doing consultations on their patients prior to their patients undergoing oncologic therapies. So within a matter of 18 months, we have already seen 475 patients from the Hospital of University of Pennsylvania whose medical histories are extremely complex, extremely integrated. So you do get that interdisciplinary medical integration within our program because we are having to consult and treat these patients and get these patients ready, even though we're thinking outside of the box sometimes, get them ready for their oncologic care, be it head and neck radiotherapy, be it bone marrow hematopoietic stem cell transplant, et cetera, et cetera. And with that, I think I've spent enough time. I hope I've answered some of the questions that I've seen that were pre-sent to us. If not, I guess, Amanda, Q&A.
Can I jump in real quick here, please?
Sure.
I think that one of the things that we would like to do is talk about the new part of our program, and I would like Dr. Morrow to address exactly what our expansion is. Our GPR is co-sponsored by a hospital and the dental school. So again, all of the interdisciplinary work of being in a dental school and working with multidisciplinary clinics, it certainly definitely exists within our GPR program, in addition to all of the hospital-based experiences. But one of the new and unique things that we are offering is something that I'd like Dr. Morrow to talk about here, our GPR rural expansion.
Sure. Thank you, Dr. Polowitz. The University of Pittsburgh has recognized that there is a huge struggle for rural Pennsylvanians to access basic dental care, with some rural communities, 2 years, 730 days plus wait before they can even get a dental appointment. And there's a almost like a perfect storm of why this is occurring. And there's definitely a huge access to care crisis that's occurring in Pennsylvania. And so our goal with these regional training centers is to put dentists, dental hygienists, and dental assistants where the need is the greatest. So that we are there's going to be a regional training center that we are going to put in Johnstown, Pennsylvania, Bradford, Pennsylvania, Titusville, Pennsylvania. We're going to have 3 residents in each center, 5 dental hygienist trainees, students, and 12 dental assistant students that are going to be in each center each year. And it's really going to allow us to address this huge access to care crisis that we're facing in Pennsylvania. This is where our general practice residency, it will still be a GPR. So there's still going to be a hospital component. We're going to partner with a regional hospital in each of these sites, as well as an FQHC, where you're going to be providing the dental care. And this is where there's kind of becomes a little more of a blurred line between a GPR and an AEGD, because the amount of unmet need is going to be so great in these areas. The amount of dental care that you're going to be providing and the experience that you're going to have in these centers, I would venture to say that it's going to rival any other type of AEGD or general practice residency program that you can do, just because of the amount of care that is needed in these communities. So it's a really Dr. Marnie Oakley, who is our dean, has had this vision of addressing this problem for some time now. And with hard work and dedication and strong partnerships, she's really been able to get this to come to fruition. And so we're excited that starting this cycle, the 2026 start date, we will have these programs up and running. Just another option for students out there as they're looking to advance their education. But yeah, thank you for letting me talk about that a little bit. I'm really excited about this opportunity to help a lot of these communities that are in need.
Okay, so now that you've heard the overview of our programs here, we can go on to some pre-submitted questions. So the first one is, what are the biggest differences between GPR and AEGD?
I'd have to believe in our conversation that that was probably already answered.
I think so. I would agree, Dr. Henschel. I would agree.
Okay. And if some of these are already answered pretty well, just feel free to say that. Okay, so AEGD, GPR for private practice and ownership.
So that's kind of an odd question, but what I will say is, as a CODA requirement for our program, and I do apologize, Dr. Hensch will have to answer this. I don't know it for an AEGD, but there is a requirement to talk about practice management. And, it's also a CODA requirement for pre-doctoral dental studies for sure. But what we do in our program, two of our attendings are MBAs, and we'll work. What we have is a full year continuum program where there's some off, own your own work that you're working on, and then we address together some of the topics of identifying a practice to buy. What is the difference between buying a practice, being an associate, different types of financing? What are the ways to maximize profitability in your own practice? What's a payer mix? What does it mean to have third-party payers? What does it mean to have self-pay? What does it mean to participate or non-participate? And how do those things factor into your decision to be in a group practice or in a academic setting, go for ownership or associateship? In our program, I try to understand what our incoming residents' goals are very quickly, very quickly. So the residents that I'm working with now, I've already known what their goals are for a month. And the reason for that is I want to make sure that when my residents are out there looking for their job, they're the first person that those practices are looking for. So the mentorship that we provide, the ability to look over contracts with you, the ability to connect you with attorneys and accountants and financial planners and insurance agents. These are things that we have been doing for decades, probably more decades than any of us would like to admit, but yet we do have that experience, and we build, because our programs are smaller and we're dealing with a smaller number of residents, your one-on-one relationship building and mentorship towards that decision is greater.
Okay. Yes, as far as the RAED program is concerned, there is a code of requirement for practice management. We have allotted within our program 21 hours of didactic work for practice management. So yes, we as well, we will bring in guest speakers, if you will, vendors from insurance companies to attorneys to contract people to discuss practice management. We'll bring in people, the latest in the EHR business, to discuss electronic health records with you, what's out there in the market, et cetera, et cetera. We'll have laboratory vendors come in to discuss how you can begin to select a laboratory that suits your needs in the office that you're working at, both from a reimbursement perspective, what your patients are paying you for procedures, and also something that's cost effective. So we as well will have the same, practice management lectures, didactics that's required by CODA.
Okay, and this one may have been answered pretty thoroughly as well, but if you have anything additional for what are the right reasons to do a GPR or AEGD?
Well, I think that the right reason to do it is because you are curious, you are a lifelong learner, and you would like to become more confident in what I hope is the rest of your career. What I have often said to my residents is getting through dental school, everything is very, very high stakes. You have your competencies, you have your board exams, and there is not a lot of time for fun in dental school. But when you get into a GPR or an AEG, I know for myself personally, that's when I truly fell in love with dentistry. That's when I started to have fun with dentistry. And it gave me an opportunity to stretch myself, try some things that were new, and to honestly have fun going into work every day. And I personally think it set the stage for me for the next 30 years of my career to really, really enjoy dentistry. And it set the foundation for me to understand that I wasn't done learning and I needed to be a lifelong learner to stay relevant in my career and to continue to enjoy it. So I think that's the right reason to do one of the either of these programs. Um, don't do it because you aren't sure if you like dentistry. I think you should do it so that it's an opportunity for you to have a year to really fall in love with and have fun practicing.
I agree. Lifelong learning is such an important aspect in our chosen profession. Dentistry is very fluid. It's constantly evolving. And the things, yes, that I was taught when I was in your seats in the dental school are not the same things that are being taught today. So I think one of the aspects of, yes, you've had 4 years of dental school, you've met your requirements. Some universities' requirements for certain procedures are minimal, shall we say. And my real question at that point in time, do you feel after maybe just doing 4 anterior root canals or 12 crown preparations that yes, maybe you've passed your competencies and you're competent to graduate dental school, but you feel you're really proficient enough to join a private practice? So I think the AED and GPR are wonderful aspects for you to further that education, lifelong learning, and really get involved with the more complexities of dentistry, and also use it as an avenue, a venue to try out different procedural techniques, try out different products and materials that might not have been available to you in your dental schools. And that's one of the things I stress in our program is that if residents want to try a material, try a product, we will do our best to get that product in their hands for them to try. Whether it's, I mean, I hate to say the word impression material since now all of my residents are doing scanning. So the analog techniques of impressions are kind of out the window right now, but they do have their purpose for some situations, no question about it. But modern day bonding, modern day adhesive techniques, et cetera, modern day principles of minimally invasive dentistry, going back to the idea that maybe not every tooth needs a full coverage crown. Maybe we can get away with onlay and we can preserve tooth structure for as long as we can. If we can preserve tooth structure, even if it's for 5, 10, 15 years, and then you have to go to a crown, we've done our patient a service.
Yeah, that's all great points, Dr. Henschel. I just wanted to I think there's a growing misconception or a growing myth out there that certain DSOs are going to provide you with the same experience as if you decided to do a GPR. I've been around some a lot of different practices and group practices. I know a lot of people. I can promise you that's not going to be the case. Yes, you can learn a lot in a D. I don't want to ever sell that short. But just like Dr. Henschel said, is you have the opportunity to try things. You have the opportunity to have a lifeline right there for you that if it's not going the way that you want, you can kind of pull back and you have somebody there who has a lot of experience that can help you kind of figure some things out. You don't have that opportunity when you're in practice, especially in a DSO, because when you're in profit-driven, models, there's no trying things out. It's this is how you have to do it. You got to learn this way. So you don't really get that type of exposure to explore your mind. So I just, I know we're not talking about that right now, but I hear a lot of that chatter as of late. So I just wanted to kind of give my 2 cents. I don't know how others feel about that, but
Okay, we can go on to the next question here. Would you recommend doing a program in the state where you want to work or somewhere else to experience it before settling down?
I'm a believer personally that you should experience elsewhere.
Me too.
I don't think it's necessary to practice in this, I mean, to do a program in the state that you want to practice in, other than, yes, maybe you'll network, you'll meet people. But, the dental profession is so small. I like to use the word 6 degrees of separation. So I guarantee you that wherever you go do a program, somebody will know somebody else where you might want to set up practice one day. And I don't think any of my former residents have ever had an issue with that.
Yeah.
I was very surprised that many of them actually stayed in the Philadelphia, Pennsylvania area. And I'm talking those who are from sunny Florida and things like that. So I don't think that's important. I think take a year to experience a different place, someplace you never maybe want to go to or visit, but take that time to experience a different place for yourself.
I really strongly agree with Dr. Henschel. I think, and I say this to D3s and D4s that I talk to and I mentor. I say it about the dental school where you would like to go. Um, it's a very big wide world out there, and the more people that you see and you meet, and the more opportunities that you have to see what's out there, the that's a huge networking right there. And you will learn many things from all of the people that you meet. I personally love when I have a class where all three of my residents have come from different schools because it really gives a great opportunity to learn from each other. There is more than one way to skin a cat. It's an idiom for a reason. It's always been that way. And it's really fun to learn from other people. And listen, if you've always thought, wouldn't it be great to live in Colorado and hike and bike all of the time? Look into a GPR or an AEGD in Colorado. If you're the only Steelers fan in a household of Buffalo Bill fans, then come to Pittsburgh for a year and do a GPR. What a nice opportunity to spend a year somewhere. Um, if you fall in love with where it is, that's great. If you decide that that isn't what's for me, great. I mean, specifically to Dr. Morrow's rural expansions, if you are someone who loves to live in the outdoors and likes something small town, but you grew up in the city and you're not really sure if you think it's for you, what a great opportunity to go and experience what that change of pace would be for you. So it's a 1 year commitment with a huge return on that investment. So I don't think you have to do it in a place where you see yourself settling down.
Okay, great. Are general dentists allowed to work in hospital-based setup without a GPR?
The answer to that is absolutely yes. Whether you have an AEGD or a GPR, have to still go through hospital credentialing. But I can vouch that yes, you can work within a hospital-based setting, get a hospital privilege, regardless.
That is true. I mean, and different hospitals may have you credentialed for different procedures, but it doesn't mean that you can't practice, that you can't be credentialed in a hospital if you do not have a GPR.
All right, we'll go on to the next slide. And if anyone has any questions, feel free to type them in the chat now. We'll go over them next, or you can unmute when we get to the next slide as well. But I just wanted to put that out there that you can type them in the chat and we'll get to them here soon. Okay, so what cases, procedures do you see in a GPR and AEGD programs? We might have gone over this a little bit, but if anyone has anything else to add.
I mean, as far as in our AEGD program at University of Pennsylvania, you basically will see the advanced restorative cases. You'll see the advanced implant cases, if you will, that are too complicated for pre-docs to do and not complicated enough for PG pros residents to do. So we do have a tremendous mix there. I know this is a generation of dentists. Everyone wants to restore implants, place implants, but the opportunity to do that is within our program, within our oral surgery department. Many of my residents do place implants. There's no question about that. You know, the old adage that, oh, you never place an implant in AEGD program is not true. Again, we can vouch for that. Our oral surgery department allows us to place implants, of course, under their guidance. So, I mean, that's what we'll see. We'll see a lot of the medically complex patients, the same that you will see in a GPR. As I discussed earlier, we see our fair share of medically complex patients. And I'll leave that to you, Dr. Polowitz, Dr. Morrow, to continue that if you'd like.
Yeah, I don't really think I have much more to add. I don't know if you do, Dr. Polowitz.
No.
Nice job.
Okay. And next one, is an international student with an F1 visa eligible for these programs?
For my program, unfortunately, at the University of Pennsylvania, you have to have graduated from either a US or a Canadian COTA accredited dental school.
That
So
is the
yes,
same.
an international student who graduated from an accredited dental school within the US or Canada and does have an F1 visa is eligible. But if it's an international student who's not graduated from an accredited university, the answer is no.
That is the same for our program at the University of Pittsburgh.
Okay.
I've had several residents who have completed an so I have had several foreign trained dentists who completed an advanced standing course at a US or Canadian accredited, well, they were all advanced standing US schools, but an accredited dental school, and were able to stay here with an F1 visa for their GPR year.
Okay. Next one, how does an AEGD, we'll put GPR on this one too, but how does it change the pay scale for private practice in general?
Again, I think we discussed that a little bit. You know, I know Dr. Morrow said he's in private practice, so he likes to look for those patients who have AEGD or GPR on their CV. When I was in private practice, I did the same thing. I'm not necessarily going to say it tips the pay scale, but maybe it gives you another foot within the door over somebody that doesn't have that experience.
Yeah, I would say that it's not going to change your starting salary, but it's going to change your earning potential pretty quickly when you start. No matter what, no matter if you are practicing out of school or whether you're practicing after an AED or practicing after a GPR or practicing after any other type of specialty residency, your earning potential is based on your ability to efficiently practice procedures, do them well so that your patients are happy and satisfied and return. So the more education and experience you have, I feel that it is pretty self-evident that you will earn more money.
All right, and the next one, I think we answered the first two parts, so we'll just go to the third. But how do programs differ across different schools, if you guys have any knowledge on this?
I'm going to refrain from that one. I'm not going to belittle any university or any other program. You just have to go with your heart. What's in your heart? asked previous residents their experiences. I know there are a lot of Google chat rooms with conversations about different programs, but I'm not going to go, what makes one different or better than the other.
Okay, good answer. And are there any disadvantages for international dental students? They asked about availability on the West Coast.
I can't answer about availability on the West Coast. That's just a search within IDEA for programs that are available. The only disadvantage for an international student would be, as far as both Dr. Henschel's and our programs are concerned, if you do not have um, a degree from an accredited US or Canadian dental school, then you are not eligible for our programs.
All right, does anybody have any additional questions? You can unmute and ask them or type them in the chat.
Just two comments I'll leave with if there's nothing else further. Patients will never care how much you know until they know how much you care about them. Take that to heart, take that forever within practice. And also, if you enjoy what you're doing, you're never going to work a day in your life. Everything will be enjoyable.
I would also like to say, and I think that this rolls in a little bit to this next slide where you're talking about looking for a mentor. I do think one of the great advantages of all of our programs, regardless of what are the foundational structural components, is because we're smaller programs with, as opposed to your dental school class, there is quite a bit of ability for each resident to have a unique experience within the programs themselves. Your attendings and your program directors and your mentors within the program really will help you identify the things that are unique to you and what your unique needs and interests are. And that is really fun for us as attendings in the program, is to see the spark that's interesting you and help you grow that. And you really do have so much more one-on-one career guidance and career development in these programs.
Okay, and if anyone is interested in getting matched with a mentor through Pennsylvania Dental Association, you can go to the link on this screen and we'll match you with a mentor based on practice type, location, and specialty. This is a really great program here, so please take advantage of it. And then also, as a student member, you can receive discounts on various products, including laptops and other tech. To view a complete list of Member Advantage partners, visit the web address shown on your screen as well. So you are all ASDA members, which means you're PDA members, which means you can take advantage of the discounts we have through our site. So the link is there as well. And then I just want to thank our presenters tonight for doing such a wonderful job covering these programs here. I will be sending out a post-event survey to your email in the next day or two, so keep an eye out for that. And I just want to say thank you all for coming tonight, and thank you again to our presenters. And if there are, oh, okay, actually, there is a question in the chat. I do have, what makes a strong candidate in your opinion? So it's this one.
So Dr. Morrow and I were just talking about this on Monday as we were reviewing the applicants that we currently have in the bin for our program. And the number one thing that I would say is I'm looking for someone who's curious and someone who has a good work ethic, because there is so much exciting and fun and new to do at the start of your career. And if you come in with an open mind and a great curiosity, competence is good too, but hopefully not, hopefully not so much that you're not willing to learn. To me, that makes a great candidate. The difference between grade point averages within dental school classes is really not what rocks the boat for me, because it's just not a great measure of who you are as a student and what you're willing to learn. And I think in our programs, curiosity and the willingness to learn is the number one thing for me.
So in our program, I'm looking for that well-rounded individual. We scrutinize your applications. We spend a lot of time reading through your personal statements. I'm not a big fan, I'll be perfectly honest, of letters of recommendation, because the majority of candidates will ask those faculty that know them the best or like them the best or the easiest to work with to write them a letter of recommendation. So I would have to believe that that letter will be a glowing letter of recommendation. So I don't hold as much weight with these letters of recommendation. Again, as Dr. Powell had said, GPAs, I mean, you're all very much similar when you apply. So GPA, again, doesn't matter to me. No, if you're, I don't look at the top 1% of the class. I'm comfortable, and it shows me someone who has strength when they're right in the middle of their class. There's a willingness to learn. There's an appreciation to want to learn more. And sometimes I find if you take that top 1, 2, 3% of the class, it's, as Dr. Powell said already, you know it all. You're not willing to learn anymore. So those are my thought processes. That's what we look for. Well-rounded individual, nice personal statement, really selling yourself. What sells you differently from the other 60 applicants to the program? Make yourself stand out.
All right, I think that was a great question to end tonight's webinar. So if there are no other questions, which I am not seeing any, we can call it a night here. So thank you again to everyone for attending, and thank you again to our presenters for coming tonight and talking with you all.
Thank you, Amanda. And thank you,
Thank you
Dr.
all.
Thank you, guys. Never stop
Thanks for
learning.
coming.
Never stop learning.
Agree.
Have a
Thank
good
you.
night, everyone.
Bye-bye.
Bye.